What if the reason your knees, hips, or ankles hurt every single morning when you get out of bed has nothing to do with how old you are and everything to do with one critical thing you are simply not eating at night? I know that sounds too simple, and I know if you are over 60 and you have been dealing with joint pain for years, you have heard a lot of promises. You have probably tried the glucosamine tablets, maybe the chondroitin. Maybe you have had injections, tried physical therapy, maybe even been handed a prescription for a pain medication that made your stomach feel worse than your knees did. And through all of it, the pain just kept coming back. Maybe it got worse. My name is Dr. Paul. I spent over 22 years as a sports medicine physician and functional orthopedic specialist, and for most of that career, I prescribed exactly what my colleagues prescribed. I gave my patients what the guidelines said to give them. I believed it was helping. And for the last 6 of those years, after watching patient after patient decline despite doing everything right, I started asking a very different question. Not how do we manage joint pain, but how does cartilage actually rebuild? And why, in some patients, does it? That question changed everything I thought I knew. Because here is what nobody told you, and what your doctor almost certainly does not know to tell you. Cartilage is not a dead tissue. The medical textbooks your doctor learned from used to describe cartilage as tissue incapable of significant repair. And that description is partially correct and catastrophically misleading at the same time. Cartilage does not have its own blood supply. That part is true. Which means it depends entirely on something called synovial fluid to receive every nutrient it needs to survive and rebuild. And synovial fluid, as it turns out, is exquisitely sensitive to something you do every single night, or more precisely, something you eat, or fail to eat, every single night. I am going to tell you exactly what that food is, but I need you to stay with me through the next several minutes, because if I just tell you the name of the food without explaining the mechanism behind it, you will walk away thinking it is just another supplement recommendation. It is not. There is a specific biological window that opens in your body every single night between roughly 10 p.m. and 2 a.m. And what you put into your system before that window opens determines whether your cartilage gets the raw materials it needs to rebuild, or whether it spends that entire window starving. Once you understand that window, the food I am going to describe will make complete sense, and you will never look at your evening routine the same way again. Before I get there, I want to tell you about a man named Robert. Robert was 67 years old when he first sat across from me in my clinic. He had been a high school football coach for 31 years, and he walked into that room with the careful, deliberate gait of someone who has learned that every step has a cost. His right knee had been replaced 4 years earlier. His left knee, his orthopedic surgeon had told him, would need to be replaced within 18 months. His hips were beginning to show the same degeneration on imaging. He had been taking glucosamine and chondroitin sulfate for 6 years. He was also taking a daily anti-inflammatory his primary care physician had prescribed for long-term use. He exercised regularly on a stationary bike because it was the only activity that did not cause pain. He watched his weight. He did everything that a responsible patient is supposed to do. And yet, he was sitting in front of me because his left knee had gotten so bad he was waking up at 3 in the morning from the pain. Not from movement, from stillness. The joint was aching in the night, when he should have been sleeping, when his body should have been repairing itself. His wife had started sleeping in the guest room because his restlessness was keeping her awake. His grandchildren had stopped asking him to their soccer games, not because he did not want to go, but because he could no longer stand on the sidelines for 90 minutes. He had become, in the space of a few years, a different person. Not because of age, because of a biological process that nobody around him understood well enough to interrupt. The first thing I asked Robert was what he ate for dinner, and what he typically ate or drank in the 2 hours before he went to bed. He looked at me like I was changing the subject. He told me dinner was usually lean protein and vegetables. Before bed, he told me, he had stopped eating entirely because someone had told him that late eating was bad for him. He would drink some water, sometimes a herbal tea. That was it. And that decision, that well-intentioned choice to stop eating before bed, was one of the most significant factors working against every repair process his body was trying to run while he slept. Let me explain to you what happens inside a joint like Robert's knee during the night, and why the hours between 10 p.m. and 2 a.m. are more important to your cartilage health than anything that happens while you are awake and moving. Cartilage is made up primarily of a protein matrix, the most critical of which is type 2 collagen. Type 2 collagen is the structural scaffolding of cartilage. It is what gives the tissue its ability to absorb compression, to spring back after loading, to protect the bone beneath it. Woven through that collagen matrix are molecules called proteoglycans, essentially water-trapping sponges that grab fluid and hold it inside the cartilage, which is what gives the tissue its bounce, its shock-absorbing capacity. When the proteoglycans deteriorate, the cartilage loses water, becomes thin and brittle, develops cracks, and eventually wears away entirely. Here is the piece that most people never hear. Your body does not stop making type 2 collagen and proteoglycans when you reach 60. It slows down, significantly, but it does not stop. And the process that drives overnight repair is primarily controlled by one of the most underappreciated hormones in the human body, human growth hormone. Growth hormone is secreted in pulses throughout the day, but by far the largest pulse, often accounting for more than half of the total daily output, occurs during the first few hours of deep sleep. That first deep sleep cycle is when your body does the majority of its structural repair work, and cartilage, with its lack of a direct blood supply, is almost entirely dependent on that nightly window to receive the amino acid precursors it needs to build new collagen. To synthesize type 2 collagen, your body needs specific amino acids in meaningful quantities. The most critical are glycine, proline, and hydroxyproline. These are not amino acids your body produces abundantly on its own, particularly as you age. And when you go to bed with an empty stomach, as Robert had been doing for months, those amino acids are simply not available in your bloodstream during the exact window when growth hormone is trying to drive collagen synthesis. The factory is open, the machinery is running, and there are no raw materials on the floor. I want to pause right there for a moment. Drop a comment right now and tell me your age and which joint is giving you the most pain. Is it your knee, your hip, your lower back, your hands, or your ankles? Just your age and the joint. Something like 64, knee, or 71, hip. I read every single comment, and I want to make sure the follow-up content on this channel is speaking directly to where you are. Now let me tell you about a woman named Dorothy, who came to see me after a referral from her primary care physician. Dorothy was 73. She had moderate to severe osteoarthritis in both knees, confirmed on imaging. She had been taking an over-the-counter anti-inflammatory twice daily for 8 months. Her doctor had mentioned that at some point she might be a candidate for knee replacement, and Dorothy had told him, in her words, "over my dead body." She was determined to find another way. What she found before she found me was a collection of supplements sourced from a health website. Turmeric capsules, fish oil, glucosamine, chondroitin, and a collagen protein powder she mixed into her morning coffee. She was spending close to $140 a month on this regimen. She had been doing it for 5 months. The pain was unchanged. Dorothy was doing something right and something critically wrong at the same time. The something right was that she was thinking about collagen. The something critically wrong was the timing. She was taking her collagen every morning, and because collagen protein consumed in the morning has to compete with every other metabolic priority your body has during an active day, energy production, immune function, muscle repair, a significant portion of it never reaches the cartilage. It gets used elsewhere, or it gets metabolized too quickly to be present during the overnight repair window. When I shifted Dorothy to an evening protocol, a specific preparation taken 90 minutes before bed, and added one cofactor that dramatically amplifies cartilage collagen synthesis, her pain scores at her 6-week follow-up had dropped measurably. At her 3-month follow-up, she told me she was walking her neighborhood again for the first time in 2 years. Not running, not hiking, walking. But for Dorothy, that was everything. Then there was Victor, 62 years old, a retired postal worker who had spent 34 years on his feet and had the joint damage to show for it. Victor came to me because his wife pushed him after watching a video online. He was skeptical, deeply skeptical. He told me, with the particular energy of someone who had been disappointed many times, that he had tried everything. He had spent money on things that did not work, and he was not interested in spending more money on things that did not work. I told Victor I was not going to ask him to spend any money. What I was going to ask him to do cost almost nothing, and I asked him to give it 30 days. Victor called my office 41 days later. He said he did not want to make a big thing of it, but his morning stiffness, the first 20 minutes after getting out of bed that had for years felt like his knees were made of rusted hinges, had dropped from roughly 20 minutes to about 4. He said he was not ready to declare victory, but he was ready to keep going. Now let me tell you something important about why you have never heard any of this from your doctor. And I want to be careful here because I am not here to criticize physicians. Your doctor is not failing you because of negligence or because someone is deliberately keeping you in pain. The reason is more mundane and in many ways more frustrating than that. Medical education devotes almost no formal curriculum time to nutritional biochemistry and its relationship to tissue repair. A physician who graduated from medical school even 15 years ago received, on average, fewer than 20 hours of formal nutrition training across 4 years of education. And within that limited training, the relationship between dietary timing, amino acid availability, and overnight collagen synthesis essentially does not exist as a subject. Your doctor was trained to identify disease and prescribe an intervention. They were not trained to optimize the biological repair processes your body is already trying to run every night on its own. There is also something about the dominant pain management approach that nobody discusses openly. Non-steroidal anti-inflammatory drugs, the NSAIDs that millions of seniors take daily for joint pain, work by suppressing prostaglandins. That is their mechanism, and it is genuinely effective at reducing pain. But certain prostaglandins are also required for collagen synthesis signaling in the cells that maintain cartilage. This means that long-term daily NSAID use, while quieting the symptom, simultaneously suppresses one of the biological signals your cartilage needs to repair itself. You feel better, and the underlying structure continues to deteriorate. I am not telling you to stop any medication your doctor has prescribed. That is not my role and not the message of this video. What I am telling you is that pain management and tissue repair are not the same thing. And for too long, we have focused so completely on managing the pain that we have neglected the repair. If this information has been useful to you so far, I want to ask you to do 2 things right now. If you have not already subscribed to this channel, please subscribe right now. And if you know someone over 60 who is dealing with joint pain, a spouse, a sibling, a parent, a friend who has started quietly withdrawing from the things they love, share this video with them today. You might be giving them something their doctor has simply not had time to offer. A thumbs up also helps this channel reach more people who need this information. Now let me give you the exact protocol. The food at the center of this is something most people have in their kitchen right now. It is not exotic, it is not expensive. It is not sold by any pharmaceutical company, which is precisely why large-scale clinical funding to prove its efficacy has been limited. It is hydrolyzed collagen peptides, or, in its simplest and cheapest form, plain, unflavored, food-grade gelatin. But the collagen is not the whole protocol. The timing is. And there is one cofactor that almost everyone misses. Approximately 90 minutes before you go to bed, not right before, 90 minutes before, to allow proper absorption before that first deep sleep cycle begins, you prepare the following. Take 15 grams of hydrolyzed collagen peptides, or 1 full tablespoon of plain, unflavored gelatin powder, dissolved in 8 ounces of warm water or an unsweetened herbal tea. Not coffee. Coffee will interfere with your sleep quality and defeat the entire purpose. Warm water or herbal tea only. To that, you add one critical cofactor, a small source of vitamin C. Not necessarily a supplement, though that works. A 4-ounce glass of pure Tart cherry juice. Tart cherry specifically, not sweet cherry, not a cherry blend, no added sugar, accomplishes two things simultaneously. The vitamin C present in Tart cherry juice is required for the hydroxylation of proline into hydroxyproline, which is a non-negotiable step in the collagen chain. Without adequate vitamin C available at the same moment as the collagen amino acids, the body cannot complete the synthesis. This is documented biochemistry. And the second thing Tart cherry juice delivers is a concentrated class of plant compounds called anthocyanins, specific to the Tart variety, which have been shown in multiple clinical investigations to reduce inflammatory markers in joint tissue specifically. You are not just feeding the cartilage. You are also calming the environment around it so repair can proceed. The core nightly protocol is this: 15 grams of hydrolyzed collagen peptides dissolved in 8 ounces of warm water with 4 ounces of pure Tart cherry juice, consumed together 90 minutes before bed. Now here is the addition I made for Robert, whose degeneration was more advanced. For people with moderate to severe cartilage loss, I recommend adding one thing each morning: 2 eggs, cooked any way, with the yolks included, which provide sulfur-containing amino acids, methionine and cysteine, that support proteoglycan synthesis. And this is where I come back to the thing I mentioned earlier that most people throw away without a second thought: the membrane inside an eggshell. That thin, nearly translucent film lining the inside of every eggshell you have ever cracked. That membrane is one of the most concentrated naturally occurring sources of type 1 and type 5 collagen, hyaluronic acid, glucosamine, chondroitin sulfate, and elastin available anywhere. Gram for gram, it compares favorably to expensive commercial joint supplements. And it is free. Every single time you cook an egg, that membrane is there. You can carefully peel it from the inside of the shell, let it dry on a paper towel, and add it directly to your evening warm water preparation along with your collagen peptides. It has almost no taste. And for many of my patients in the 65 to 75 range with moderate joint involvement, adding it produced the most consistent early results. Let me address the questions I already know you have. First, I am already taking glucosamine and chondroitin. Should I stop? No. These are legitimate structural precursors, and there is reasonable evidence they support proteoglycan maintenance. The problem with most commercial approaches is wrong timing, insufficient dosing, and the absence of the collagen precursors and vitamin C that make the repair process work. If you are taking them, move the dose to the evening and include them alongside this protocol. Second, I am a vegetarian. Can I do this? The animal-derived collagen peptides are the most bioavailable form, but there is a meaningful plant-based approach. Silica-rich preparations, horsetail herb tea, and bamboo extract are the strongest sources. Support the collagen matrix indirectly by activating fibroblast signaling. Combine that with a high vitamin C source in the evening and ensure your overall protein intake is adequate. It is not identical to the animal-based protocol, but it is not without effect. Third, how long before I feel a difference? I want to be honest with you here, because honesty is more useful than optimism. Cartilage is one of the slowest regenerating tissues in the human body. In clinical studies using objective imaging to measure cartilage thickness, meaningful structural changes typically require 3 to 6 months. What most patients report subjectively is a reduction in morning stiffness within 3 to 4 weeks, and a reduction in overall daily joint discomfort within 6 to 8 weeks. The 30-day time frame refers specifically to that first measurable symptom shift, the morning stiffness window. Not structural repair, which takes longer. Be patient with the tissue. It is repairing. It simply does so quietly and slowly. Fourth, is this safe if I am on blood thinners? Tart cherry juice has mild antiplatelet properties. If you are on warfarin or any anticoagulant, speak with your prescribing physician before adding Tart cherry juice to your daily routine. The collagen peptides and gelatin are safe for virtually everyone, but the tart cherry component warrants a conversation with your doctor if blood thinners are part of your regimen. I want one more thing from you before I wrap this up. Drop one of 3 things in the comments right now. Write starting tonight if you are going to begin this protocol tonight. Write tried collagen before if you have used collagen previously, but not with this timing or the tart cherry cofactor alongside it. Or write skeptical but listening, because I genuinely respect that, and I want to hear from you either way. Every one of those comments tells me something meaningful about what this community needs from this channel. Let me bring everything together. You are over 60. Your cartilage repair window opens every single night during deep sleep, driven by a growth hormone pulse that your body is still producing. That window requires glycine, proline, and hydroxyproline, amino acids delivered most effectively by hydrolyzed collagen peptides consumed 90 minutes before bed. It requires vitamin C present simultaneously, delivered most efficiently through tart cherry juice, which also delivers anti-inflammatory compounds directly to joint tissue. And for many people, it is enhanced by the addition of eggshell membrane, the thing you have been discarding for decades, which contains naturally occurring hyaluronic acid, glucosamine, chondroitin, and collagen in their most bioavailable forms. Robert, 7 months after starting this protocol, in combination with a modification of his anti-inflammatory use that his prescribing physician approved, had his scheduled left knee replacement reassessed. His imaging had not dramatically reversed, but it had stabilized. His surgeon used a word that Robert told me he had never heard used about his knees before. He said the tissue looked preserved. Robert's surgeon pushed the surgery timeline out by a full year to continue monitoring. Robert walked into that follow-up appointment at a pace that, he told me, he had not managed in 3 years. I spent over 2 decades in medicine watching patients lose ground while being handed tools that managed symptoms without supporting biology. The gap between managing pain and actually supporting repair is why I do what I do now. The body, even at 60, even at 75, retains a capacity for repair that medicine has systematically underestimated. What it needs is the right raw materials at the right time. That is not a miracle. That is biochemistry. If there is someone in your life who needs to hear this, a spouse who has been quietly limiting their world because of joint pain, a parent who has stopped doing the things they love, a friend who has been told that surgery is their only option, please share this video with them right now. You have the information. Passing it on costs nothing. And click on the video appearing on your screen right now. I am going to walk you through the 3 specific morning habits that most health-conscious seniors over 60 are practicing every single day that are actively accelerating cartilage breakdown, including one that almost everyone in this audience is doing and has absolutely no idea about. Click now before you forget. Subscribe if you have not already, and I will see you in the next one.